Hello, this is Dr. Lewerenz at Longevity Health Institute. I hope this finds you well and enjoying our late September warm weather. End of my day here at the office, and I wanted to cover something that's really common I see here weekly and have to go over with patients and kind of put their mind at ease. And I thought I'd share it with you and you could share with others. The other thing is I'll go over my typical thing that I say is the 2 did you knows, big common things that are simple and something just to remind you of and share with others and practice yourself because it'll give you some good wellness and longevity. One is related to food and how we eat and the high levels of sugar, and the second thing is how sugars and diet really affect mood. And it's such a common thing now for young, and middle-aged, and older now to be grabbing things for energy and caffeinated things, high sugar things, and how they really affect us. But the first thing I want to go over is this: thyroid issues and thyroid nodules. I see them all the time. I have probably 1,000 patients with thyroid dysfunction, whether it's low thyroid, Hashimoto's, autoimmune thyroid, Graves' disease, you name it. We work with them all the time and help them successfully manage the thyroid condition. But one thing that's really common and really prevalent is a thyroid nodule, which just means that there's a growth on the thyroid, whether they palpated it, it was discovered incidentally by ultrasound or not, and there's a big concern about what this means. So let's just review and put your mind at ease. Statistically, thyroid cancer is extremely low, and even when you're diagnosed with thyroid cancer, the incidence of thyroid cancer affecting your longevity and your life is very low. I'm not saying unheard of, but very low. Mortality rates are very low, and 5-year survival rates are very low, literally in the single digits as far as percentage with thyroid cancer. Most thyroid nodules are benign. Literally like 95% of thyroid nodules in most studies are shown to be benign. In fact, actually autopsies performed in some studies on patients that were over the age of 60, autopsies showed that nearly 60% of individuals had a thyroid mass or a thyroid nodule, which never ultimately affected their life. So do we need to look into an ultrasound thyroids? I think we do. We need to be vigilant about it and consider cancer, but just to be aware that thyroid cancer is extremely rare. There has been studies that showed that the amount of thyroid fine needle biopsies has gone up rapidly because of fear. And when you talk about cost and risk benefits, I do believe that it's a little bit of zealous diagnostics and potentially even therapy. Watch thyroid nodules. We often use iodine here to control thyroid nodules and treat them. But even with Hashimoto's, which is a very common autoimmune condition, less than 2% of Hashimoto's develop thyroid cancer. So something I thought interesting, something I want to share with you because I know, we have relatives, family, and friends that have thyroid conditions. So something very important to know. Let's get back to the 2 did you knows. One is this, is that did you know that probiotics and gut flora are extremely interactive? So of course all of us know about good flora and good bacteria of the gut and how this influences your well-being and your immunity. Very important. And the benefits of probiotics and good gut flora. But actually how you eat, and particularly fiber and natural diets, really influence that. Meaning when you eat a healthy, high fiber diet that is more like Paleolithic, or what we would say the studies are based on Tanzanian natives that actually ate more off the earth. They had over 100 grams of fiber in their diet and ate a lot of plant-based, natural occurring things, that they developed the most beneficial gut flora. And you can imagine industrial societies in America here, we eat tons of junk and high sugars and that. And simply how you eat changes your gut flora and your gut microbiome, which ultimately changes your immunity. So it's not just about taking a high dose probiotic or eating a lot of yogurt and getting these benefits. It's actually about just, hey, be smart about how you're eating. If you eat junk, your gut flora is going to be junk. You're going to have poor gut flora and have ultimately a poor immunity. So influence your gut flora, influence the probiotics and the good flora in your body by just making smart digestive choices. The other thing is is a second did you know, is how drastically your sugar consumption in your diet affects mood. So there's studies out of London, University College in London, that they studied over 10,000 individuals, and actually the people that had the highest sugar consumption had the most correlation to mood disorder later in their life, and not necessarily late in their life. Actually, the study was a 5-year follow-up, and actually the American diet, we recommend 30 to, healthy 30 to 40 grams of sugar per day. The average U.S. Individual consumes 3 times that. The average European citizen consumes 2 times that. And we're seeing this astronomical rate of mood disorder. In fact, actually in the study they predicted by 2030, it would be the economic leading influence on disability, meaning that the most common disability in the world globally will be mood disorders, depression, anxiety, etc. So what's important here is to know that, we all love sugar, we all love things that, taste nice and, give us a little energy in that. But eating such a high sugar diet and having this many grams and calories based on sugar influences the brain, influences the mood. So anxiety and depression are very linked, very, very linked to how much sugar consumption you have. And it literally could be to an effect to where it would even cause a disability or have you seek a doctor. So if you're considering or think of yourself or others you may know that have some mood changes and that, you really, really, really have to impact to them the importance of their diet and limiting sugars. We often here at Longevity Health Institute focus on gut health, a paleo, a vegan, natural, if you will, based diet, plant-based diet in that, and influence the amount of amino acids and good proteins they get in. And like I said earlier, even related to their good gut flora, because those are nutrients and minerals and vitamins that feed the brain and make neurotransmitters like dopamine, serotonin, norepinephrine. And without those, we develop anxiety and mood disorders. So very important, good diet, good gut health is extremely important. So hope this was enlightening. This is Dr. Lewerenz at Longevity Health Institute. We have 2 practices, Lewerenz Medical Center and Longevity Health Institute, Madison Heights, Michigan, and Rochester Hills, Michigan. I'm a functional regenerative restorative medical doctor that's board certified in family practice. You can find us on longevityhealthinstituteinc.com or find us on Facebook. Again, I hope this finds you well, and I hope this was enlightening. Have a good day.